Excited to have my next guest join me because healthcare and how we get taken care of in these places, particularly when we think about the issues of equity in healthcare, is critically important. Cristal Gary is the CEO of Meridian Health Plan of Illinois, and she's here with us this morning. Cristal, good morning and welcome to WVON. How are you today?
Good morning, Rufus. I am great. How are you?
I am wonderful and good to talk to you. The things about health, I mean, if we don't have that, then we don't have anything. And we just talked about Princess Kate just a bit ago and what all the challenges were there. But you've got some interesting things going on at Meridian Health Plan. Maybe we should begin by just talking about what is Meridian Health Plan. Tell us about it.
Yeah, and thank you so much for the opportunity to come on and to talk about this. So Meridian Health Plan, we are a health insurance company. We provide government-sponsored healthcare programs like Medicaid, managed care. We also have Medicare Advantage through our WellCare brand, and we offer individual coverage through the Affordable Care Act health insurance exchanges through our And Better product. So across all of those different products and populations, we cover almost 1 million people across Illinois.
And so with that, I'd imagine you have quite a few Medicaid or Medicaid customers as well. Mm-hmm.
Yes, absolutely. So we have about 800,000 members, as we call them, in our Medicaid program and cover almost 50,000 in Medicare.
So talk about this new effort that's happened there with the Joint Commission in receiving this healthcare equity certification.
Well, health equity is something that's it's a passion of mine. As a Black woman and someone who's worked on healthcare and healthcare policy for most of my career. And it's something that's very important to us as an organization, too, because when we think about the people that we serve, particularly those who are on Medicaid and Medicare, they tend to be lower income. They tend to be disproportionately impacted by health challenges, by chronic conditions. And so we really understand that we cannot serve those people well if we're not keeping equity at the forefront of everything that we do, that we're walking alongside them, that we're understanding, their life journey, their challenges, helping address the social determinants of health that they might be experiencing. So we're always, kind of actively thinking about the ways that we can, better serve them, and also understanding that, we're a health insurance company. We cover health care, but we don't provide it. So we need partnership with those providers, with the doctors and the hospitals that are actually delivering that frontline care to the individuals that we cover. And, we look for ways that we can, really be partners with them and collaborate with those providers to support their efforts to address health disparities and provide more equitable care. So the program that I'm here to talk about today that we launched last week is an incentive program for those providers to, really support and encourage them to seek a health equity certification. So most hospitals receive an accreditation through an organization called the Joint Commission. And the Joint Commission has also made health equity one of its priorities, and it created the certification program as a way to provide a structure and a framework for healthcare organizations to really look deeply at their systems and their practices to make sure that they are setting themselves up to be an equitable organization and to provide equitable care. And the certification is, one important way that they can, now seek to do that. And we wanted to be, we wanted to really help the hospitals that are moving in that direction. So this incentive program is a way that we can do that, both financially by providing, partial reimbursement for the cost of that certification, and also, really as they, get that recognition, the hope is that, their patients will look for that and will, really be holding their hospitals accountable for providing that equitable care and asking about that certification to encourage more hospitals to move in that direction.
So what do those providers have to do in order to attain this certification, and what should people look for when they're visiting these type of providers?
Yeah, so there are a number of areas that the certification, really looks at for hospitals. I'll take a step back and, just say, and I know this is nothing new to your listeners, that unfortunately we know that disparities exist in health outcomes for certain racial and demographic groups, particularly African Americans. And these disparities can be driven by a lot of things. They can be driven by, explicit or implicit biases, but they can also be embedded in institutional practices that can impact equity in ways that could be less obvious. So the certification, really kind of encourages providers to look at things like their data collection. Are they collecting data on their patients, that on, race, ethnicity, language preferences, sexual orientation, and because having that data is the first step in one, being able to provide culturally sensitive care. And it's also important for being able to do the next step, which is the data analytics. So once you have that information, are you really looking at health outcomes, by race and ethnicity to make sure that, there's awareness of any disparities that exist. And, that way they can take active, initiatives to address it. Looking at their practices around addressing, language and cultural barriers, training for their clinicians and their staff on, on racial, bias and, equitable care. So those are some of the things that hospitals are doing, in thinking about health equity and, that their journey toward the certification really puts more structure around to make sure that they are doing those things in a way that aligns with best practices.
Got it. We're talking with Cristal Gary. She's the CEO of Meridian Health about their program that's providing incentives to help hospitals achieve healthcare equity certification from the Joint Commission. We'll have more with CEO Gary right after this. Welcome back. We're talking with CEO Cristal Gary. She is the CEO of Meridian Health Plans. Dr. Gary, tell me this. Are you finding in looking at this issue of health equity, is there resistance to some of the work that's trying to be done to achieve health equity? Are you finding that we're getting closer to the target?
As you know, Rufus, there is a backlash against health equity and DEI efforts across the country. I would say that fortunately, we're not experiencing a lot of that here in Illinois. In fact, there's a lot of interest and support for health equity amongst our state leaders, legislators, and the entire healthcare community. I know that, we're continuing to stay the course in our commitment to health equity as an organization. And, we are finding continued commitment across the hospital community as well. In fact, we've partnered with the Illinois Health and Hospital Association on this, and they'll be helping us to educate the hospitals that are part of their association, on this effort. And they've been, kind of leading their own health equity initiative among their hospital members for years.
So as it goes, there are some who this is a much longer journey, but you are seeing progress is happening, and certainly as you put forth this these incentives. Usually incentives happen because you're not getting what you need to get to initially, which is kind of why I asked the question whether or not people were resistant to moving towards an issue of equity.
Yeah, I appreciate that, and thanks for that context. So we at Meridian are in the process of our own health equity journey, of course, and as you said, it's an ongoing process. So we have for health insurance companies, we have a different organization that we get accredited by, which is called NCQA, the National Committee for Quality Assurance. And we are in the process, we're getting to the end of the process of getting our health equity certification from NCQA, which we expect to get within the next month. And that's been about a year-long journey. And, similarly for the Joint Commission, their health equity certification is fairly new. I think has also been launched, within the last 12 to 18 months. So I wouldn't say that this incentive program is in response to resistance. I would say that, it's something that, we felt as we've gone through this process has just been very helpful to us as an organization. And we know that hospitals have a lot of things on their plate, right? I don't know how much you may have talked about this, on your show, but, the healthcare industry is experiencing, shortages of healthcare workers. They've been experiencing, increasing, violence within hospitals and emergency rooms. They've, been experiencing, financial and budget pressures. So we just know that they have a lot of things that they are trying to do, all at once. And, felt that this was just a way for us to continue to encourage and support the hospitals that are moving, along this road, and signal to them that we want to continue to be an active partner with them in this work.
Thank you for that. I feel better about it now. much better. Tell us a bit, because this is also, and I'm excited about my lineup today. This is Women's History Month, and you are running this large Medicare, Medicaid health plan, health insurance program, corporation. Talk to us about your journey to get to where you are.
Oh, wow. It's been probably a little bit of a unconventional journey to be where I am, in particular as a health insurance executive. I started my career in government. Spent about 15 years working in state and federal government, mostly here in Illinois, in the Illinois Medicaid Agency, which is called the Department of Healthcare and Family Services. And then I was deputy governor of Illinois under Governor Pat Quinn, and had the opportunity to be here on WVON many times during my tenure there, as I led a lot of healthcare initiatives and helped to implement the Affordable Care Act in Illinois, back during that time. And when I left government, I really knew that healthcare was my passion. You said at the beginning of this section that, if you don't have your health, you don't have anything. And I've truly believed that. And that's why healthcare and health equity has just been the focus of my career. So I wanted to stay in healthcare. I, went and worked for a couple of different hospital systems here in the Chicagoland area, working on community engagement, community health, health equity, and, just had a great opportunity to get more experience in healthcare from that provider perspective. And then this opportunity at Meridian opened up about 7 months ago, so I'm still fairly new in this role, but I really gravitated toward this opportunity because in many ways, it's very similar to where I started my career, working in the Medicaid program, and my passion for serving this Medicaid population because it is one of those populations that tends to be underserved and has a lot of health challenges and a lot of trouble navigating the healthcare system. And that's what we do as a managed care company. We're really in a position to be able to walk alongside our members throughout, the different stages of their life. We provide care coordination. We provide, clinical programs for those who have chronic conditions. I think, I know we have an opportunity to do that. You may have heard, or your listeners may have heard, the stat that, only 20% of your health is based on the care that you've received directly, in the doctor's office or the hospital, and the rest of it is, what happens in the rest of your life. And so we cover, those health services that happen in the doctor's office or the hospital, but we also have that opportunity to provide other programs and to provide that care coordination and those navigation services to help those individuals in achieving their health and wellness in that other 80% of their life as well.
Well, Cristal, thank you for that, and thank you for the work that you've done and the work that you continue to do in this very important and necessary space. Good to have you on and good to catch up with you again. Thanks for all that you're doing.
Thank you, Rufus. It was great to talk to you again.
You too. Be
Thanks
well.
for having me on.
Indeed. Be well.